I started researching on my own, certainly talking to physicians that I work with, some in the field of medical oncology, some in the arena of radiation oncology. And so these were close colleagues that I worked with on a daily basis. And everybody said the same thing: surgery, chemo, radiation. So this is, coming, out loud and clear. So one of the things that every cancer patient thinks about is, am I going to live? And if so, how long? And how many patients, live to 2 years, 3 years, 5 years, 10 years? What are the numbers like? And it was so interesting because I now know what it's like to go hunting to find those statistics you like. And there were many good statistics for my situation. I was a stage 3C endometrial cancer, very aggressive cell type, aggressive tumor. And with the lymph node pattern that I already knew of on my PET CT scan, I was already a stage 3C. And when stages go from 1 to 4, I was pretty close to 4. And the numbers weren't great. In fact, they were pretty discouraging. I had a 30% chance to live 3 years. And I thought, well, you know what? It's not a 0% chance to live 3 years. Let's go for it. I was so fortunate. My surgery went very well. It was a 5-hour-long surgery, and I promised my wonderful Dr. McCluskey that I would stay overnight in the hospital, although I truthfully could have gone home. I was so fortunate. I had no nausea, I had no vomiting, no pain, and never took a pain pill. And surgery being on Friday, I could have worked on Monday. But I promised her I would take a couple, 3 days off, which I did. But I was able to recover very quickly from surgery, and thanks to her wonderful skills of being able to do this laparoscopically, I had no huge abdominal incision. And so I called them my 4 little peepholes, were really a minor inconvenience. And so I returned to work, and within 2 weeks of surgery, I knew that I would start on chemo. And so Dr. McCluskey had recommended to me that I do 6 cycles of chemotherapy, which actually translated into 18 treatments. And so starting on the 12th of January, I had a double treatment of carboplatin and Taxol. And then the next week I'd have a single Taxol, the next week another Taxol treatment. Then I had a little chemo holiday, 1 week off, and then I would start the cycle over. Carbo, Taxol, 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 holiday. So I went through 6 cycles of that, and during the chemo treatments I of course would visit with Dr. McCluskey. And again, I was so fortunate because even though I had concerns about my reaction to the chemotherapy, it went very well.